want to just welcome you if you're just joining me in. I'm now live on YouTube. Okay, so for those of you who have turned in live on YouTube, welcome to Charles Lee Aesthetic Surgery. We are live today. Today is what is called a Q&A. It's a question and answer session. More questions and answers. And thank you very much for sending me all your questions, because fat reduction is a hot topic. It's something that everybody wants to lose, right? Everybody wants to know. But the first thing they ask about is how much does it cost? And I think that's not fair to yourself. Okay, so I'm sitting here with two machines, and these machines cost 780,000, both of them. And you need both. So if you go to any doctor who is trying to sell fat reduction using machines, always ask them whether they have these two. One is to break down the fat, and the other one is to strengthen the skin, tighten the skin. If you want to get the best results, you need both. It's called a combination. It's a combo. Just like when you go to McDonald's, right? You ask for a combo, right? You get it, it's cheaper, right? So you can have your drink, you can have your burger, and you can have your fries. Here, you get your fat broken down and lysed, and then you get your skin tightened at the same time. That's a win-win. That's why this particular treatment that we have here in my practice, Charles Lee Aesthetic Surgery, is top gun. Nobody else has it. And I want to just talk to you about it today. So the topic today is about fat reduction. It's not about losing weight. All right? It's not about losing weight. When you lose your weight, your whole body loses weight. But when you're talking about fat reduction, there are certain areas in the body where fat becomes reduced. Okay, so that's very important for you. Number one, I'm going to talk to you about a non-surgical way of reducing your fat volume. Okay, I've been doing tummy tucks. I was just saying that, women who come to see me and come and do what's called tummy tuck, where we just cut all the excess skin and fat, and then we stitch the lower part of the abdomen together. Now, I'm not sure whether you can see me from there, but remember that liposuction is where we use 1 atmospheric pressure. We put in a cannula and we suck out the fat. It's a blind procedure. And so after assessing the patient, I would know where the fat pockets are, and then I will put in this long cannula, and I'll just under negative 1 atmospheric pressure, I'll be sucking out the fat. Both procedures have a risk, and the risk is death. Okay, that's the worst risk you can get. But it is a risk. Just like when patients come to see me, they want to get their eye bags done. And it's sometimes done in a hotel. It's sometimes done in some clinic, some saloon, some beautician somewhere, some aesthetic person out there is getting doctors flying in and removing fat bags. Let me tell you, one of the complications of removing eye bags is blindness. All right, so you want to have the real deal, you go and see the real doctor that is a plastic surgeon. All right, and the plastic surgeon is honest enough, he will start off with the risk. So that's what I do in my practice. The first, I tell the patient, what's your risk? It's like flying in an aircraft. You get into a plane, the pilot doesn't say and tell you the risk. Oh, there's a possibility that this plane can end up in the ocean. No, you trust the pilot. You trust people on board to get you safely from point A to point B. Same with us. When we do a procedure, because of the medical legal problems that we can face as doctors, we are obliged to tell you the risk. And once you know the risk, that's it. Your interest is my interest. I have your interest at heart, your best interest. And that's the reason why we always do a consent. We take a consent, which is called an informed consent. Patient signs, and you know what's the deal. Today I'm talking about a non-invasive procedure to lose fat or to get fat reduced. And because it's non-invasive, the risks are very, very low, except we have what's called contact risk, which I will tell you as we go. So coming back again, fat reduction is not about weight loss. It's about reducing the volume of fat in certain pockets in the body. Now, there are two types of fat, okay? There's a superficial fat here under the arms, tummy, all of us have superficial fat all over the body. And then there is the visceral fat, which surrounds your organs. The moment I do abdominal surgery and I go in, the first thing I see is a whole apron of fat looking at me, which is called the omentum. All right, so that's the first thing I see. The moment I open up and I go into the abdomen, when I'm doing abdominal surgery, is to see this yellow apron waiting for me, greeting me. You know, it's like a skirt. That's called the omentum, and all the fat is around the organs, your kidney or the heart, or every organ will have a bit of padding of fat around it. That's called visceral fat, different. Today we're talking about superficial fat. So this fat is in certain areas in the body where they collect as stubborn deposits. No matter what you do, you can't get rid of it. It's a different kind of fat. When I do abdominal surgery, again, I don't know whether you can see from there, but when you go in, you can see these yellow pockets of fat. It's like chicken fat, you know. And that's what we target when we do liposuction. All right, those are the yellow, deep, stubborn deposits that we remove when we do when we do liposuction. So this non-invasive way of reducing fat uses a kind of technology and a principle. There are many ways that you can reduce fat, but what I'm talking about today is using, cold. All right, using a temperature by freezing. When you freeze fat, that fat dies. It's just like when you go to the North Pole or the South Pole, you can end up with, frozen bites, and you can end up with a finger that's completely lost and it turns color, it turns black, and the whole thing becomes mummified, So freezing, when you freeze fat, the metabolism of the fat cells starts to slow down and ultimately it dies. And that's really what you call cryo. Cryo means cold, freezing, cryo. Lipo is fat. Lysis means destruction, breakdown. And so this procedure that we call cryolipolysis is the breakdown of fat in a non-invasive way using cold, all right, using freezing. And so when we do cold temperature, the metabolism of that fat particular cell, called the adipocyte, starts to decrease and finally stops and ends up with death of the fat cell. That's the principle that you need to know, all right? And so what they normally do is they come in here in certain areas of the body, for example, the tummy, okay? In the tummy, in the lower part of the tummy, you pick it up, like in this picture above me, and you will be able to see that, that fat is, especially in the abdomen, there are two layers of fat, okay? And one is called the scarpa layer, the other one is called the camper, and they are different. The metabolism is different. So whenever we do liposuction surgery, we want the deeper layer. Because if you become more superficial in the abdomen, you end up with dents. For those who have done liposuction, I don't know whether you have done it or not, but you'll find that it's very uneven in certain areas because it's gone too close to the skin and it is permanent. So let me tell you this straight away up front. When you lyse fat cells, it is permanent. Liposuction is permanent. Fat reduction is permanent because fat cells don't replace themselves, just like the brain. You get a stroke, you'll always have that damage done to that brain cell. Same with fat. The moment the fat cells dies, it doesn't start growing back again. It dies. It's death and is removed. Later on, I will explain how. So when they come and ask me, one of the first questions that I got in here is, Doctor, is fat reduction or cryolipolysis, is the result permanent? So as I'm talking, I'm going to reply to your Q&As, okay? The answer is yes. It's permanent, and so the results are long-lasting. But because when you reduce that pocket of fat, it doesn't mean that when you start eating again and start putting on weight, the other cells don't hypertrophy. Now, listen carefully. If you have got 10 cells of fat cells here, 10, they don't become 100, all right? They don't multiply. Fat cells go either bigger, hypertrophy, or they go smaller, shrink, hypertrophy. And that's the reason why you can burn your fat out, and when you're fasting and all that. So at the time of birth, your fat cell content is the same. That's why they have found out through studies with those who have got all these lumps in their tummy, in their saddle breeches, on the sides of their thighs, hip rows. They were all chubby babies, you know. It was called poppy fat. When you get a nice chubby baby, you pinch the cheek, the thighs look like mutton chops, right? Big thighs like mine were when I was born. They tend to end up with a problem of these fat deposits later on in life. Okay, and that's why there are different shapes to people when it comes to body shapes, you know. And fat is then pocketed in certain areas and is really difficult to remove. So cryolipolysis is a way of targeting in a non-surgical way, in a non-invasive way, those areas in the body, for example, the arms, the tummy, the inner thighs, the outer thighs, which is called the saddle breeches, all right, even the chin, okay, the bra area, the bra straps. You know, when you wear a tight bra, especially, you know, certain races, at the back you'll find these two handles that look like boomerangs, you know, and they're right there on the back, and it's so annoying. And so those are areas where we can actually freeze that fat and melt it and break it down so that you get a nice shape and it's permanent. Okay, so this is so how quickly can so let me just continue where I'm talking about. So I've talked to you about what's a non-surgical way. I've talked to you that it uses cold temperature. That's why it's called cryo, which is the method that I have here with me in the practice. There are other methods. You can use heat, you can use laser, you can use ultrasound. Nowadays they have something called HIFU, right? High intensity frequency ultrasound, where they hit out an ultrasound beam, and that again targets the fat cell and melts it. Okay, I don't like it because the results are quite variable. I like this, what I have, and that's why I bought it. Okay, so I've already talked about different types of fat. So how does it work is the next question. So again, using cold temperature, the area of fat. Now, for example, this machine here, this is called Z-Lipo, all right? Because the company that makes it is called Zimmer. I'm not here to promote the company. I'm here to promote the technology. And so this is Z-Zimmer, and so it's got a kind of a whole plate here. And so there's a cup in here, and this cup will then be placed on that area. Let's say it's on my tummy. So it'll be placed on my tummy, and then when it goes on, this particular area sucks up the fat by a kind of a vacuum. It goes into this area, and between these two cold plates, it starts to freeze. And when it freezes to a temperature of about -4 degrees, -5 degrees, fat cells die. They don't immediately die, but after a couple of months, 2-3 months, you will find that they'll continue to lyse, and then they'll be removed out by the body, okay, because they're dead. And the process of removing all these cells out is called apoptosis. The cell dies, it's called cell apoptosis, and then it melts down, and then it is taken out by the liver, excreted through the kidney as, you know, as triglycerides. So this is what it has. It has this cup thing here, and this applicator is then placed either on the tummy, or it can be placed under the arm, or it can be placed on the hips. It can be placed in any area that has this. Now, let me just put this carefully in here. Yeah. Okay, so this is called Z-Lipo. I love this machine, and when we apply it on, it's left on for about an hour. There are some machines that do it for 35 minutes, 40 minutes. Big no deal. It's all technology. It's the same. It's like scratching your nose. You can scratch your nose this way, and you can also scratch your nose this way, right? So at the end of the day, it's all a marketing gimmick. When people say freeze fat 35 minutes for perfect results, all that is marketing gimmick. My job is to tell you how it's done, and it's done by using cold temperature, freezing, and this freezing then kills the fat cells, and by a process of breakdown, it is then removed out through the liver, out of the body, excreted out. And it's really safe, and it's really good. Okay, really nice results. So if you're struggling with certain areas in your body, for example, the tummy, for example, the arm, for example, the hip rotation, I know, someone's shouting out a question there, how much does it cost? Wait, learn the technology first. It's like looking at a house so beautiful and then can't afford it, right? If it's too beautiful a house. So let me tell you the beauty part of it, and then the cost will come later. Okay, and if you stay till the end, you'll get a special discount from me today, just for today, right, Mary? It's just for today, a special discount today. All right, if you stay till the end. So, Mary, you're making notes, right? Well, yeah. So, and I hope that you'll stay till the end. And don't afterwards, when the program is over, PM price. As I told you on Wednesday, I'll delete your name. Don't PM price. Just know it, make an appointment, come and see me, because everybody's body is different. So if you ask me PM price, I'll give you the most expensive price because I don't know what you look like. All right, so there you go. So it's kept on for about an hour. And after an hour, usually there are two areas because there are two arms. So sometimes you like to do the arm here and then the tummy at the same time so that both the arms are like octopus, you know. They will just freeze both areas. And then we'll change it to the other side for the next hour. So usually within 2 hours, you can do two areas, which means times 2, which is 4, because there's a left and a right and a left and a right, right? So usually by the time we finish all the 4 areas, it's about 2 hours. Some patients come in here and they go for 3 hours, you know, because they have other areas to do. So depending upon where the problem is, then we will then sign up the patient for that. And the more areas you do, of course, the cheaper it is. So that's one question. And then the next thing they asked, another question came in, how quickly can you see the changes? So you know the principle, which is cryolipolysis. This is the new generation. This is the latest generation. And it's a revolution, because you know why? It's not just melting down the fat, it's also about tightening the skin, which I'm going to show you about. Okay, so the results are usually in about first month you will get about 10 to 15% results. So remember, it is fat reduction. Okay, it is not fat loss. You don't lose weight, it's reducing of fat content. All right, so this is very important. And if you're on intermittent fasting, excellent at the same time, because it also sheds off water. A lot of the problems we have in that fat is water logging, you know. And so that's why I love the procedure that is here to give you some nice results. And so in the first month, you get about 10 to 15% of your result. And then second, third, it gets better. And usually after about 6 weeks to 2 months, I will then reassess whether we need a second session. All right, because some people come in like me, they're really big and they need 2 sessions or 3 sessions. Remember, this is non-invasive. The risk is hardly any risk. If they're told there's any side effects, would be something to do with the skin, which I'll come to later. All right, so I've talked about the areas. That's another question that was just asked. What are the common areas? The most common for us is the tummy. All right, the abdomen and the thighs, right? Those are the most commonest areas. Arms, yes, but there's always a degree of skin laxity. So these are the two things. Whenever I assess a patient that comes in for fat reduction, the first is, where are the pockets? Where is the problem? Okay, so if it's a saddle breaches on the sides of the thigh, outer sides of the thigh, those are called saddle breaches. I like liposuction, better result. If they are the hip rolls, you know, the love handles, when you're dancing, you got your hands on the love. That's why they call love handles, right? I just cannot understand. Mary, correct or not? They want all the areas, but they tell me, don't touch my love handles. I love my love handles, you know, so that when I'm dancing, I can feel it. Okay, so that's your baby. So I also like my love handles, you know. So that's why they call love handles. So it's excellent to reduce fat there. The other commonest is the inner thighs, you know, in between your thighs. That because sometimes they rub, and it's called chaffing, and it's quite it's quite incapacitating to some ladies because they have to sit with their legs open because it's uncomfortable. There's so much of fat there that it tends to rub as they are walking, and that can be a bit. It's difficult to get into jeans. Because of that inner thigh fat. So I like to do those areas. And always, like I say, whenever we do fat reduction, when I'm assessing the fat content, I'm also assessing the skin elasticity. Because the result after fat reduction is to do with your skin elasticity. You can freeze the fat till the cows come home. But if that skin doesn't have the elasticity to recontour, I got a problem. The patient will not get a nice result. And that's the reason why we have this combination treatment between fat reduction and skin tightening. You need both to give you that beautiful contour that you want. So inner thighs is a popular area that they normally seek after. If it's in the area of the knees, by the side of the knees and all that, I like liposuction. Arms, again, yes, because again we will see the degree of skin elasticity. If the skin is hanging down to the floor, then no point doing this kind of non-invasive, because you need skin excision and tightening, right? So those are, it's called brachioplasty. That's where surgery comes in. But still, some patients who are just borderline, they got this nice guitar-shaped thing on the side of it here, hanging. We do reduction at the same time, skin tightening. All right. So yes, I'll talk about the tightening of the skin in a little while. And I've got another 10 minutes left. How long does the freezing last? Well, as I said, it's a permanent result. If you watch your food and diet well, so that the other areas don't hypertrophy. The areas that I've done liposuction or the areas that I've done fat reduction are permanent. But it doesn't mean that the other fat pockets don't blow up because they are storing fat. And that's the reason why it's important for you to maintain your exercises, your whatever program you have, if it's intermittent fasting, or just continue to get that body into shape, okay? And does it work for belly fat? Excellent. Excellent for belly fat, especially those who are models, They got a lovely figure, but they got this banana roll just below the nevus, just below the umbilicus, just below that belly spot. They got this kind of a, bean-shaped stuff thing that really looks like a donut there, Excellent for this procedure of, we call it Z-Lipo. Z because of the company Zimmer, okay? So there you go. So that's a question that was asked. Now, does it also offer us skin tightening? Mary, any more new questions coming in? Does it offer us skin tightening? Yes. So here we go. So this is Z-Lipo, as I've spoken to you about. It has an applicator with a cup here, and this cup will then suck in the fat area, and then there are two freezing plates, and those freezing plates will freeze that fat sucked into this area down to -4 degrees for about an hour. Some machines are less, doesn't bother me, as long as the technology keeps it at -4 degrees. And then over a period of time, a few months, those fat cells that have been frozen break down through a process of apoptosis, and then they're excreted out and it's melted away. And that's how you do this cryolipolysis, okay? Let me just talk about some of the side effects of the skin because it's cold. That's why we always assess the fat deposits very carefully. If they are more, I've got a caliper here. If it's more than 2 inches, nice. I know that there's enough of fat to suck into the applicator. But if it's just skin being sucked, then what happens when you freeze skin? You can end up with blisters, or you can end up with a little bit of redness, and the skin starts, because it's frozen, right? And so you may have some problems with the skin, but otherwise it's a perfect, very safe procedure to do. Now, after we've done what's called Z-Lipo, then we do a procedure called Z-Wave. Now, this is acoustic wave. This is shock wave. And this shock wave blasts the fat because they are all now frozen into like icicles. They are small cubicles, all full of ice, right? It's all frozen. So what this does is it breaks it down so that it's nice and smooth. And at the same time, it tightens the skin. So usually if patients come in to see me and they've got a little bit of skin excess, laxity of skin, but they've got their fat pockets, then we will do the Z-Wave first for about 4 sessions. Tighten up the skin, and then we go and freeze it. Okay? So that's why don't PM price when it comes to me as a plastic surgeon. Get a professional consultation. It costs only 150 ringgit, but at least you are assessed properly, and then you get the best deal and you get the best result that we can offer and that what the machines can do. All right, so please respect these technologies. 780,000 here. All right, so this is not something cheap down the road. Okay, so this is something that is well earned and well deserved, and you deserve a consultation. So after the procedure is done, immediately you'll get a sausage looking frozen lump and a hump, all right, because it's all been sucked into that applicator. And then what I'll do is the girls here will do, Mary and will do this, where she puts this onto the lump, which has just been frozen, and then break down. It's like, you're going to have a drink, you break down a whole block of ice and you chip it down, right? Same thing, you break down all those ice. And what happens is this. Now, I'm just going to demo to you. So it's a shock blaster, all right? Acoustic shock blaster. And so when you go, it breaks down also. It's something like this. So let's say I've just done my arm and I go, okay? So it goes up and down, all right? And while I'm doing this, all right, it depends on, where the area is. So it depends on which area has been done, whether it's the tummy or whether it's the inner thighs or whether it's your bra strap or whether it's your arms. You need this shock blasters, to really break all that fat cells down. Otherwise, you end up with lumps. Just one of the complications of liposuction was that we were seeing a lot of these lumps, very uneven, right? But with a shock blaster, it's fantastic. It's called Z-Wave. And this will end up with tightening because of the heat produced by this particular technology. The fibrous septae within that cells, in the inner layer of the fat, get tightened, and when they get tightened, they smooth out, and you get a lovely result. This is also used for cellulite. If you're having problems with cellulite, come see me. If you're having problems with stretch marks, come see me. Oh boy, you see, it's very sensitive. And if you have problems with somebody talking too much, come and see me. You just do it on the mouth. But anyway, jokes aside, it's a beautiful machine called Z-Wave. And it's really excellent. Sometimes what happens is that after you do Z-Lipo, there's always lymphatics, you see. There's lymphatics at the pipelines everywhere, even on the face when you go and do massaging. I'm amazed how when I see people do massaging and then they are doing so-called lymphatic drainage, and they drain all these lymphatics in the face and they go right down and they go and do it and drain it to the right side. Nonsense. I tell you, I have seen it, and these are professional videos on Instagram where they do all these massaging techniques, and then they drain the whole thing and they do it to the right side. There is no drainage on the right side of the neck. It's always the thoracic duct on the left. And that's why when you come here and do your facials, my girls are trained on how to do your lymphatic drainage and drain it into one duct on the left side, which is called the thoracic duct. So if you're listening in and you're doing all this aesthetic work, make a note of it. Go and Google this, okay? Thoracic duct, because that's where the lymphatic drainage of the face goes. Same with fat. When we are freezing fat, there's a lot of lymphatic which is blocked in there. And this is a beautiful way to do lymphatic drainage, okay? And it drains out. So once again, if I've done my arms, there'll be a kind of a lump here because it's frozen. And then I will just take this and I'll just keep on over it until I get it all nicely evened out, and it also tightens the skin. Now, for those of you who, for example, after delivery and you've got some skin laxity, you can still come and do this Z-Wave to tighten up the skin. It's a beautiful way to tighten skin tightening because of the heat, dermal heat, and those fibroseptae get tightened. And so the superficial and the deeper layers of the skin get very narrowed in. And so it's a beautiful technique. So if you've just delivered, you've got a bit of laxity in the skin with fat, and it's just being rubbed around, you've got these stretch marks, come and get your skin tightening here and we'll fix it for you. So that's really what the questions are. And if you've got any new questions, please let me know. And so remember that you need both. You need fat reduction at the same time. You need skin tightening, and both of them. So, but this Z-Lipo is only meant specifically for fat reduction, whereas the Z-Wave, which is the shock blaster, which is for skin tightening, you get excellent results when you combine both together. Okay, so that's the reason why we get some nice results. Now, at the same time, for those patients who are a little bit bigger and they've got more fat deposits, then I do chemical lysis, chemolipolysis, chemical lipolysis, where I do a concoction of chemical and I then inject it into the areas after I've finished. So that even melts it faster, especially over the chin, double chin, right? we have what's called Chemolipolysis. It's a combination of 2 or 3 concoctions, and they can get together, and then I'll just kind of like, inject it over the chin, so you get a nice shaped up chin. Okay, so that's basically what we were going to talk to you about. Now, the cost of this is depending upon the number of areas that you do. And usually it is more than 4 areas, because it's very often they would have the arms, the hip rolls, the tummy, and the inner thighs. Those are the commonest areas. So if you do more than the normal price, because these are all German made, right? They're expensive machines, and so normally the price is about 2,008 to 3,002 per area together with both machines. But right now, today, we're having it at 1,005. Is that correct? For more than 4 areas, 1,500, which to me is a song, because the girls have to work really hard to give you a nice result. It includes 4 free sessions of this Z-Wave. So that's the package for today. So if you sign up today, or you make a consultation today, WhatsApp 016-824-5224. Today, you will get this special deal where your consultation is free. You get 4 treatments of Z-Wave free, and you get a personal assessment by me free. And at the same time, the cost is only 1.5, which is a song, okay, for $780,000 equipment. I sell this because I love you all to get into shape. I'm struggling myself, and so I find that this is really the latest. Don't ring me up and ask me, do you have Haifu? I say I got Hi-Fi, but no Haifu. You see, these are all market names that are being coined around as if there's no other way to reduce fat. Know the principle. Know what you can get. Know what kind of result you will get, and how long will it take you. Because you can have the most expensive machine in the world, and if you do not know how to control your diet, and you do not know how to take your exercises and live a lifestyle, you're going to get it all back. I'm telling you from experience. I have all these machines, and yet I can put back 10 kgs within 2 to 3 months. So it's all here. So I wish there was a machine that I can go here and drill it here and get myself in shape, But it's all about discipline. But today, 35 years ago, it was all surgery. When I started my plastic surgery practice 35 years ago, it was all tummy tuck, tummy tuck. This whole album is full of results of tummy tuck. It takes about 6-7 hours, but there is a risk. And that risk was death. But because we are all trained plastic surgeons, we're always very careful. So it was always surgery. And then slowly the technology became better, because we were able to suck out the fat and then put it into the face. We could put it into the breast for those who have had breast surgery. And then they have an area of the breast where the lump has been removed. And so we used to pump fat in. But that gave us problems when we did fat transfer, because fat breaks down, fat lyses, and you get what's called fat necrosis. So we ended up with lumps in the breast, and then we had to do CT scan, because we were concerned whether that breast lump is a cancer or is it just breast lump, fat necrosis. And so we've gone through all these, varying treatments and technology, and then came in lipolysis. And with lipolysis, which is breakdown of fat, there were different methods. There was heat, water, all sorts of ways. But at the end of the day, it's the skill of the plastic surgeon when it comes to the assessment of whether this patient will have a good result or a mediocre result. So choosing the ideal candidate is important. All right, all this technology I've talked about, if you're not the right candidate, you will not get the nice result. But at the end of the day, it comes to choosing the right candidate. And so if you're having problems with fat deposits in your arms, in your belly, in your inner thighs, in your saddles, in your hip rolls, in your bra area, chin, do make an appointment, 016-824-5224, and we'll be happy to see you. So friends, there you go. That's enough for today. I want to just thank you very much for joining me on Instagram, Dr. Charles Lee Sabah. once again live on YouTube. And plastic surgeon Dr. Charles Lee. Please like, subscribe, share, love, send everything you want. Get my social media going. For those of you on Instagram, I want to hit 5,000 before the end of August so that I also can shout Merdeka. You know, my girls and I have been working hard to hit the 5,000 mark. So if you can share it, if you can love it, you can, you know, just do it so that we can hit the 5,000 mark. Mary? Then we can shout like like Tunku Abdurrahman 3 times Merdeka. So Friday, sorry, you want to say something? Vacancy. And yes, so at the same time, Mary has just told me that we are actually having a vacancy right now for anybody who's doing sales and marketing. If you're good in sales and marketing, you love aesthetics, you love me, you love the team, you love what we do, you want to become, and you want to earn 10,000 a month through network marketing, well, sign up and come and work here. Because, you know, it's not just about working and getting a 2,000 salary. It's about enjoying the skills that you have in you, your potential being lived up. And so I'm making a personal invitation live on all these social media. If you're looking to be a sales and marketing person, if you have got multimedia experience, because we've got all this media going on here, like as if I feel like I'm in a TV station. Come and work with us, and you will learn skills from me. After 40 years of working and 35 years as a plastic surgeon, I will train you how to make a business opportunity through skin health, and that's the best place to be, really, when there's so much like this going on. Tell me one other place lunchtime, instead of sitting out there in some coffee shop and cafe and talking things that don't matter to you, talk about things that where you can earn. Because earning is a gift for life, okay? So I hope you enjoyed today. Fat is a big problem. I struggle with it. But at the end of the day, it's a discipline of the mind. So whatever treatment you do here, you walk out through that door, it's about how disciplined you are when it comes to your own health. I know I'm struggling with it. But I'll struggle with you. I'll walk with you. And together we'll be a win-win situation. So everybody, thank you very much. Have a wonderful weekend. We will see you next week. Next week, Friday, make a date with me. We will be on what's called the Heart Talk podcast through Inner Club. I will be doing a Zoom live with a lady in Kuala Lumpur called Kamini. And Kamini is an excellent lady. She's a coach. She's a talent trainer. She handles stress. She handles anger. She handles a management. She is a person to listen to. All right. And I met her, you know, and I kind of like sourced her out through LinkedIn, and we connected. And I love talking to people like this because their best interest is in someone else's life. That's hard to meet people like that. So stay alert when we send out all the invitations to join us next week Friday. Make a date. What date is it next week Friday? 22nd. 22nd is next week Friday. And we'll be going live with a girl called Kamini from Kuala Lumpur. She's with a team called Wellington Resources. And I can tell you something, you know, she has got those Wellington boots that are made for walking, you know what I mean? And it'll be very interesting. So if you love what we do, join us for lunch. And I hope that you will enjoy your time too. So from all of us here, from Mary, thank you, Mary. From all of us here, have a wonderful remaining lunchtime. And I'll see you guys next week, Friday. Bye for now.